Here is a detailed explanation of Takotsubo Cardiomyopathy. 1. Introduction. Takotsubo Cardiomyopathy, TCM, also known as broken heart syndrome, is a sudden, transient heart condition that presents similarly to a heart attack. It is usually precipitated by intense emotional or physical stress and is characterized by a temporary weakening or ballooning of the heart's left ventricle. The condition is typically reversible within days to weeks, distinguishing it from myocardial infarction. TCM is gaining recognition due to increasing awareness and advances in diagnostic imaging. Definition. Takotsubo cardiomyopathy is defined as a transient and reversible systolic dysfunction of the left ventricle, primarily affecting its apex and mid-segments, often triggered by acute stress and occurring without obstructive coronary artery disease. The condition leads to a balloon-like shape of the left ventricle, resembling a takotsubo, a Japanese octopus trap. 3. Etymology. The term takotsubo is derived from Japanese. Tako equals octopus, tsubo was pot or trap. Japanese physicians first observed the similarity between the balloon shape of the left ventricle during systole and the pot used by fishermen to trap octopuses. 4. Epidemiology, gender. Over 90% of cases occur in postmenopausal women. Age group, common between 50 and 75 years. Incidence accounts for approximately 1 to 2% of all suspected acute coronary syndromes, ACS. Geographic distribution occurs worldwide, but most frequently reported in countries with advanced cardiac diagnostic facilities. Recurrence rate estimated at 5 to 10%. Nash-Havai 5. Apical type, classic. Most common form, 80%. Apical ballooning with basal hyperkinesis, 2. Mid-ventricular type, ballooning of the mid-segments of the LV, normal apical and basal segments. 3. Basal type, reverse takotsubo. Basal segments balloon, apex is hyperkinetic, more common in younger patients. 4. Focal type, localized dysfunction of a small area of the myocardium. 5. Global type, rare, involves global hypokinesis of the entire LV. HAMA 6 causes emotional stress, loss of a loved one, divorce or breakup, public speaking, arguments, fear, physical stress, severe illness, e.g. stroke, seizure, surgery or trauma, asthma attack, medical conditions, pheochromocytoma, catecholamine-producing tumor, thyroid disorders, medication substances, epinephrine, dobutamine, catecholamines, illicit drug use, cocaine, idiopathic, no identifiable cause in some cases. 7. Risk factors. Female sex, especially postmenopausal women, older age, history of mood or anxiety disorders, neurological conditions, e.g. epilepsy, head trauma, substance abuse, lack of estrogen protection in postmenopausal women, previous episode of Takotsubo cardiomyopathy. 8. Complications. Acute heart failure, cardiogenic shock, arrhythmias, ventricular tachycardia, atrial fibrillation, left ventricular thrombus and embolism, mitral regurgitation, cardiac rupture, rare but potentially fatal. Recurrence, up to 10% may experience another episode. #9, Pathophysiology, step-by-step process. 1. Triggering event, sudden emotional or physical stress. 2. Excess catecholamine release, surge in epinephrine, norepinephrine. 3. Myocardial stunning, catecholamines cause direct toxicity, coronary spasm, and microvascular dysfunction. 4. Left ventricular dysfunction, particularly affects the apical mid-segments of the ventricle. 5. Ballooning effect, apex balloons out during systole. 6. Reduced cardiac output, leads to chest pain, dyspnea, or hypotension. 7. Gradual recovery, myocardial function typically normalizes in 1 to 4 weeks. Tip 10. Signs and symptoms. Chest pain, similar to myocardial infarction, dyspnea, shortness of breath, palpitations, nausea or vomiting, fainting or syncope, fatigue, cold sweats. Signs of heart failure, peripheral edema, pulmonary crackles. Diagnosis. Electrocardiogram, ECG, ST segment elevation or depression, T-wave inversions, QT prolongation, cardiac biomarkers, mild elevation of troponins, elevated BNP or NT-proBNP, echocardiogram, LV wall motion abnormalities, e.g. apical ballooning. Coronary angiography, normal coronary arteries, no blockage. Cardiac MRI, confirms wall motion abnormalities, no infarction on late gadolinium enhancement. Chest X-ray, pulmonary edema. Lab tests to rule out other conditions. 12. Nursing diagnosis. Acute pain related to myocardial stress and ischemia. Decreased cardiac output due to impaired ventricular function. Anxiety related to fear of death or serious illness. Ineffective coping related to emotional stress. Risk for fluid volume overload due to heart failure. 13. Medical management. Beta blockers reduce sympathetic stimulation. ACE inhibitors or ARBs improve cardiac remodeling and reduce afterload. Diuretics manage fluid overload and pulmonary congestion. Anticoagulants if thrombus is detected. Oxygen therapy for hypoxia. Sedatives or anxiolytics in cases of severe stress or anxiety. Management of underlying conditions, e.g., treatment of pheochromocytoma or seizures. Nursing management. Monitor vital signs and oxygen saturation closely. Continuous ECG monitoring for arrhythmias. Administer prescribed medications timely. Monitor fluid intake output and signs of heart failure. Provide psychological support. Educate the patient about disease, triggers, and prevention. Encourage rest and gradual increase in physical activity. Prepare the patient for possible diagnostic tests. Hamashta 15. Treatment options. Acute phase treatment, supportive care, oxygen, pain relief, pharmacological therapy, beta blockers, ACE inhibitors. Subacute phase, stress reduction techniques, therapy or counseling, lifestyle changes, diet, smoking cessation. Chronic phase follow-up, regular echocardiography, heart failure management, psychotherapy if needed, cardiac rehabilitation. Tabber 16. Psychosocial interventions. 1. Cognitive behavioral therapy, CBT, helps in modifying stress-inducing thoughts and behaviors. 2. Mindfulness-based stress reduction, MBSR, incorporates meditation and breathing exercises. Support groups. Sharing experiences with others reduces anxiety and isolation. 4. Grief counseling, beneficial for patients who experience bereavement. 5. Relaxation techniques. Deep breathing, progressive muscle relaxation, and yoga. Prevention. Identify and manage emotional stress early. Use of beta blockers in recurrent cases to blunt catecholamine effects. Avoid stimulants and excessive alcohol. Counseling for anxiety, depression, or grief. Educate patients on recognizing early warning signs. Encourage regular medical checkups. Conclusion. Takotsubo cardiomyopathy is a unique and reversible heart condition often precipitated by emotional or physical stress. Though it mimics a heart attack, it typically resolves with supportive care. Early recognition, accurate diagnosis, and holistic management, addressing both physical and psychological factors, are key to a full recovery and prevention of recurrence. Thank you. Have a nice day.